Hello, my name is Dr. Brownson Jemima. Today we'll be talking about diabetes mellitus. Diabetes mellitus happens when the body is unable to control blood sugar. The body is unable to use the sugars from our diets. So there are different types of diabetes mellitus. Basically, they are classified into the insulin-dependent diabetes mellitus and non-insulin dependent diabetes mellitus. What this means is that insulin, which is a hormone in our body that is responsible for uptake of sugars and other metabolites, is deficient. Or in the non-insulin dependent diabetes mellitus, the body is resistant to the effects of insulin, and as such, in either of the classes, there is elevated blood sugar in the body. Now, what are the symptoms of diabetes mellitus? What kind of symptoms do people get when they have diabetes mellitus? They can present with excessive thirst, excessive urination, blurred vision. They may have headaches, unexplained tiredness, fatigue. Most times they may even be dizzy. Diabetes mellitus can affect the heart. It can cause chest pain, difficulty in digestion, or bloatedness. Diabetes mellitus can also cause erectile dysfunction in men and muscle weakness. If it affects the nerves, it can cause tingling sensation or paresthesias. Now let's talk about the complications that can occur from the heart and the vascular system. It can cause a heart attack. It can cause coronary artery disease, which is narrowing of the coronary vessels, which are the blood vessels that supply the heart. It can also cause high blood pressure. It can also affect the eye, damaging the retina, and can cause blindness or retinopathy. It can cause cataracts by causing opacity of the lens in the eyes. Diabetes mellitus can affect the kidneys and it can cause a chronic kidney disease. Now, how do you make a diagnosis of diabetes mellitus? Now that we've known about the symptoms, there are several different tests. One of them is the fasting blood sugar, which is a sugar test after an overnight fast of about 8 hours, a glycosylated hemoglobin, an oral glucose tolerance test, as well as a random blood sugar. The management of diabetes is multidisciplinary because it affects all organ systems in the body. First, the management would start from a diabetic education to understand what diabetes is all about, the complications that ensues from diabetes, and hypoglycemic awareness. Because if you're on medications for diabetes, either insulin or oral hypoglycemic agents, you need to be aware of signs that will tell you when your blood sugar is low. The next step in the management of diabetes is dietary modification and lifestyle modification. The dietitian will work with you to arrange a healthy diet for you. Lifestyle modification like exercise and cessation of smoking and alcohol is also important in the management of diabetes. Other aspects of management is in the monitoring of blood sugar. You have to monitor your blood sugar daily or as the doctor would recommend. How do you prevent diabetes? The prevention of diabetes will entail controlling the modifiable risk factors of diabetes, like weight, cessation of smoking and alcohol, adopting a healthy lifestyle like frequent exercise and dietary modification. You can adopt a DASH diet and a Mediterranean diet. This has been shown to help to reduce the chances of developing diabetes.
At Regional Stroke and Neuroscience Hospital, we run a diabetes clinic. We have an endocrinologist who is a medical consultant specialized in the management of diabetes. We also have a dietitian and nutritionist who is experienced in diabetes management. Our state-of-the-art laboratory can conduct all the specialized tests needed to diagnose and manage diabetes. Our physiotherapist can help you design an exercise plan. Our clinic is open Monday to Saturday from 8 a.m. to 4 p.m. For more information, call the numbers on the screen.